Let's see another question. The cutoff value of normal prostate specific antigen level is 4 nanogram per deciliter. If this value is to be decreased to 3.7, the sensitivity and specificity will change. How would lowering the normal PSA in cancer screening alter the number of false positive and false negative? So let's understand the question. What are they doing? They are decreasing the cutoff. Decreasing the cutoff means, suppose earlier there were, I'll talk some figures so that it will become easier for you to understand this, because you need to understand the concept of biostats in order to solve the questions. You can't just by heart and expect you to answer, because most of them are clinical scenario based. So let's understand it first. So the PSA level was earlier set at 4. So suppose we are screening a group of 100 patients, and 10 of them have, you know, have had a level of more than 4, and they were found to have prostate specific antigen levels high or prostate cancer. So initially it was like 10 people. What will happen when we are reducing the cutoff? When we are reducing the cutoff, there will be more people who will be added who have a value between 3.7 and 4, right? So definitely the number of people would increase. From 10, say, it can become 15 or 20. So what happens to the number of people who are being diagnosed? That will increase. So we are being asked about the false positive and false negative. So when we are picking more people to have the disease, what will happen to the false positive? We are getting more people into the pool of deceased. That means more people may have a false positive, because we are having an earlier cutoff, a lower cutoff. There will be more people who may not have the disease, but they are diagnosed to have the disease by this test, because we had a lower cutoff. How about false negatives? Since we are having a low cutoff, we are actually picking more people with the disease. Okay, more people with the disease, and we are reducing the false negative. False negative means what? They have the disease, but the test have excluded them. Now the cutoff is low, the test actually includes them. Okay, so here what happens is there is decrease in false negative but increase in number of false positive.